Welcome to another nursing mindset video where we will discuss pharmacologic principles. Today's nursing mindset is know the process, protect the patient. Pharmacologic principles can feel like a long list of terms: absorption, distribution, metabolism, excretion, half-life, steady state, peak, trough, bioavailability, and first pass effect. But these terms are not just definitions that we need to memorize. They actually explain what happens to a medication after it enters the body. And that directly affects how safely you administer and monitor those medications. So let's walk through the process. We're going to start with the medication itself. Before a medication reaches the patient, you need to understand what you're working with. So a medication, they have a chemical name, a generic name, and a brand name. Now, the generic and the brand name versions, they contain the same active ingredient. They have to. But their inactive ingredients can differ, and they can differ considerably. And that can affect things like appearance, absorption, or patient tolerance. You also need to consider the dosage form: a tablet, liquid, enteric-coated tablet, injection, or transdermal patch. When we're talking the same medication, but the dose form changes how the medication dissolves, how quickly it's absorbed, and when it begins working. That's why you can't automatically just crush a tablet or change the route just because it might seem easier. The dosage form and route are part of the medication order. Let's move in and talk about pharmacokinetics. So this is basically what the body does to the drug. And a helpful way to organize pharmacokinetics is to think about four main steps, or what we call the ADME process. And that means that we're going to be talking about absorption, distribution, metabolism, and excretion. So first up, absorption. So absorption is how the medication enters the bloodstream. And here the route that we're giving the medication is going to matter. So for instance, an IV medication, when we administer it directly into the bloodstream. So it's 100% bioavailable. Oral medications, they usually have a lower bioavailability because they must be absorbed through the gastrointestinal tract, and they may pass through the liver before entering systemic circulation, which is the first pass effect. Because part of an oral medication may be metabolized before it reaches circulation during that first pass effect, the oral dose may be different from the IV dose. So that's why a lot of times you're going to see oral doses being higher than what they are if we're giving an IV dose. All right, let's move into distribution. Once the medication is in the bloodstream, it has to travel to its site of action. Many medications bind to proteins such as albumin. And when that happens, it's only the unbound or free medication that is active. So that means a patient who has low albumin levels may have more free medications circulating, which then increases that risk for toxicity. Now, a lot of patients take more than one medication. So let's say they're taking two highly protein-bound medications. They're going to compete for those same protein binding sites, increasing the amount of active medication in the bloodstream, thus increasing risk for toxicity. All right, let's talk about metabolism. Most medications are metabolized in the liver. The liver chemically changes the medication so it can be used or eliminated. If the patient has liver disease, medication metabolism may slow down. The medication can then accumulate and increase the risk for adverse effects or toxicity. Other medications can also affect liver enzymes. Some medications inhibit enzymes and raise drug levels, while others induce enzymes and lower drug levels. Finally, let's talk about excretion. Most medications are removed through the kidneys, although some may also leave the body through the lungs, sweat, saliva, or breast milk. But since most are excreted through the kidneys, if kidney function is impaired, the medication may remain in the body longer than expected. Again, this is going to increase the risk for accumulation and toxicity. Now think about half-life and steady state. A medication's half-life is the amount of time required for half of the medication to be removed from the body. A medication with a long half-life stays in the body longer. A medication with a short half-life is removed more quickly. So let's put that into context. Think about the older adult who already has poor functioning liver, they have poor functioning kidneys. And so now if we give them a medication with a long half-life, it's going to stay in the body much more long time. And that's going to really increase the risk of toxicity. And so here, medications with a short half-life are going to be much more suitable for an older adult. Now, after about 5 half-lives, most of the medication has been eliminated. Steady state usually occurs after 4 to 5 half-lives. This is when the amount of medication entering the body pretty much equals the amount being eliminated. So why does this matter for nurses? Well, it matters because it helps to explain dosing frequency, how long it may take a medication to have a consistent effect, and whether the medication may accumulate. Pharmacologic principles also help you understand when to monitor. So when we're looking at things like onset, peak, and duration, the onset tells you when the medication begins to work. The peak is when the medication reaches its highest concentration or maximum effect. The duration, this is how long the effect lasts. We also have trough. Trough is the lowest drug level, usually measured immediately before a next dose is given. Some medications also require peak and trough monitoring because the difference between an effective dose and a toxic dose can be very small. Your job is not just to give the medication. Your job is to know what response you expect, when you expect it, and what findings could indicate an adverse effect or toxicity. So here's a nursing mindset. Do not look at medication administration as one isolated moment. Think of it as a process. What form is the medication in? How will it enter the bloodstream? How will it travel through the body? How will the liver process it? How will the kidneys remove it? How long will it remain in the body? And how will I know whether it's working safely? When you understand the process, medication administration becomes more than just completing a task. It becomes informed clinical judgment. So here's my final thought. As you learn medications throughout nursing school, you will apply these same principles again and again. The medication may change, but the process remains the same. Understand how the medication enters the body, how the body handles it, how long it remains active, and what the patient needs you to monitor. That knowledge helps you recognize risk, prevent harm, and evaluate the patient's response. Know the process, protect the patient, because that's the nursing mindset. Keep developing yours.